Sofosbuvir, Velpatasvir, and Voxilaprevir for previous treatment HCV infection. Patients who are chronically infected with hepatitis C virus (HCV) and who do not have a sustained virologic response after treatment with regimen containing direct-acting antiviral agents (DAAs) have limited retreatment options.
HCV is usually transmitted through blood-to-blood contact. The virus replicates in the hepatocytes of the liver and circulates throughout the body. Entry into hepatocytes occurs through the interaction of the viral envelope with receptors on the surface of the host cell. The virus undergoes a fusion and uncoating step, releasing positive strand viral RNA. HCV utilizes many of the host cell's proteins and molecules in order to replicate. The first step is the translation of the viral RNA genome into a polyprotein. The polyprotein is processed by both host cell and viral proteases into structural and non-structural proteins. An essential step in the replication of viral RNA is the interaction of the host cell protein cyclophilin A with the viral proteins NS5A and NS5B. This enables the functional replication complex. A replication complex is now formed to generate new viral RNA. A negative strand RNA intermediate is formed and is used as a template for the synthesis of positive strand RNA. The viral RNA is then packaged to form new HCV virons. The virons mature in the Golgi apparatus and are released from the host cell by exocytosis.
Application in medicine. We conduct two phase 3 trials involving patients who had been previously treated with a DAA-containing regimen. In Polaris, one patient with HCV genotype 1 infection who had previously received a regimen containing a NS5A inhibitor were randomly assigned in a 1:1 ratio to receive either the nucleotide polymerase inhibitor Sofosbuvir, the NS5A inhibitor Velpatasvir, and the protease inhibitor Voxilaprevir. 115 patients were matching placebo, 115 patients once daily for 12 weeks.
Really great news about hepatitis C. So here you are, a typical baby boomer born between the years 1945 and 1965, going about life without a care in the world. And it's been recommended that all baby boomers get tested for hepatitis C because of the increased risk in this group. So you do as you're told, only to find out that you indeed have hepatitis C. This is always a shock to your world. There is increased concern for yourself and your family. The life as you know it is in question. Thinking you've done well. The family cat, nice cars. You've saved for the future and been able to buy nice stuff. But now you feel as if you've been struck by lightning. Everyone always wonders, why me? Why did this happen to me? So what exactly is hepatitis C? Well, hepatitis C is a disease of the liver. The liver is involved in almost 200 different processes to keep us all healthy. The hepatitis C virus invades your liver attacks it and potentially makes you very sick. You may feel absolutely 100% normal at first, but most have some mild fatigue. They may have some very vague flu-like symptoms, and in about 15 to 20% of the people with hepatitis C, they develop cirrhosis. Once cirrhosis develops, you can develop liver cancer, and in some situations, you may need a liver transplant. Some die from hepatitis C. Despite all of this, we do have smiles on our face, and the future looks very bright for those with hepatitis C. After years of researching new drugs to treat and eradicate hepatitis C, the time has come, with music in our ears, joyous that we have new drugs to treat hepatitis C effectively, safely, and with far less side effects than we've been used to. Here in America and in other parts of the world, hepatitis C patients should be celebrating, rejoicing that we now have a green light with all the regulatory work done with FDA approval of 2 new, very effective and very safe drugs for hepatitis C. The 2 new drugs are Sofosbuvir and Velpatasvir, and they have recently been approved for use, and the success rate is absolutely staggering. These new drugs can attain an 80 to 90% cure rate in a wide range of patients with hepatitis C. All of us at Liver Specialists of Texas are dedicated to spreading the good news on hepatitis C. Making use of social media, including YouTube and Twitter and Facebook, allows all of you to get tested and determine if these new drugs are right for you.
Pros and cons. In the 3 active treatment groups, 46% of the patients had compensated cirrhosis in Polaris 1. The rate of the sustained virologic response was 96%, with Sofosbuvir, Velpatasvir, Voxilaprevir as compared with 0% with placebo. In Polaris 4, the rate of the response was 98% with Sofosbuvir, Velpatasvir, Voxilaprevir, and 90% with Sofosbuvir, Velpatasvir. The most common adverse events were headache, fatigue, diarrhea, and nausea. In the active treatment groups in both trials, the percentage of patients who discontinued treatment owing to adverse events was 1% or lower.
Hi, I'm Dr. Joe Galati, and what I want to do in this brief video is really to give everybody a brief overview of some of the new medications that are going to be coming out for hepatitis C. And it's really quite amazing for those of us that have been involved in the care of patients for hepatitis C, really from the beginning, to have all of these breakthrough medications now finally FDA approved is really remarkable, both for our patients and for all of us that are taking care of these marvelous patients. And the key breakthrough is with Gilead, who has been really one of the pioneers in developing these new medications for hepatitis C. Their latest compound, which is a combination of Sofosbuvir, which was released about a year ago, and Velpatasvir, which is their new compound, which they've been working on for a while now. These are now combined, 2 very potent hepatitis C medications into one pill, combined medicine in one pill. And when taken by itself, just these two drugs in combination in patients with hepatitis C, it has an incredible virologic response and what we call a sustained virologic response. And it really is almost too good to be true, where patients are getting over a 95% cure rate with these medications, and there is minimal side effects compared to the therapies that we've had in the past with the interferon and ribavirin. And for many patients that have had to go through these therapies, you're aware of all of the side effects and complications, which really were a barrier to getting treated. Many patients and physicians were very concerned about the side effects. So what this does now is it really opens the door to be able to treat or think about treating many, many more patients. Patients that are more advanced with cirrhosis possibly, or liver cancer, those waiting for liver transplant. We would have really never considered using interferon in those patients due to the side effects and very low chance of curing the virus. Here, very low risk profile, very high chance of curing the virus, and so the logic is we should be able to offer therapy to these patients. At the same time, patients that have slightly less advanced disease will probably also benefit from the treatment, where several years ago we may not have wanted to expose the patient to much more toxic medicines if they were just sort of early in their disease. And so this breakthrough with Gilead, the FDA approval will be really any day. Here we are in the early part of October 2014. We're all very excited. And of course, if you have continued questions, feel free to give us a call and visit our website for ongoing
Issues of blight in Ecuador. Sofosbuvir, Velpatasvir, Voxilaprevir, taken for 12 weekends provided high rates of sustained virological response among patients across HCV genotypes in whom treatment with a DAA regimen had previously failed.